In this question, a 7-year-old Caucasian boy, again, I'm going to focus on the age, 7. Caucasian boy is brought to your office by his mother. He was stung by a bee. So bee sting, bee sting. 2 weeks ago, so it's been 2 weeks, and developed a generalized urticaria and required hospitalization. Later, he developed puffy face and now reports foamy urine. So puffy face, foamy urine. His past medical history is otherwise insignificant. He's found to lose 4.5 gram of protein. So he's losing 4.5 gram of protein in his urine. Of the following, which is the most likely to be abnormal and useful in the diagnosis of this condition? So this is quite obvious. This is minimal change disease. Usually minimal change disease is associated with some sort of maybe a respiratory infections or immunization, and in this case it's a bee sting. Okay, what triggers it? Usually it's some sort of insult, respiratory infections or immunization or bee sting or any kind of insult like that. And well, insult can also cause in a young age, in an age like that, you can also have post-streptococcal. But post-streptococcal is a nephritic syndrome. This is a nephrotic syndrome, so that's why this is going to be nephrotic. Okay, moving on. Now let's look at some of the options that we have here and kind of explore the options. Option A says urinary sediment microscopy. Okay, what kind of histology are we going to see in minimal change disease? I thought I'll discuss it later, but it begs to be discussed here. About minimal change, what kind of histology are we going to see? What are we going to see in light microscopy? What are we going to see in electron microscopy? What are we going to see in immunofluorescence, right? Light microscopy is going to be normal. We're not going to see anything. Electron microscopy, we all know, we're going to see effacement of podocytes. Podocytes, not podocytes, podocytes. And immunofluorescence, we're not going to see anything as well because there is really no immunoglobulin deposition or there is no complement deposition. So the only histologic finding we're going to see on electron microscopy is effacement of podocytes. That's the only thing that happens. Okay, another thing I want to talk about is what happens to the basement membrane in minimal change disease. Now the basement membrane is negatively charged. In fact, the basement membrane provides two types of selectivity. One is charge selectivity, the other is size selectivity. So the basement membrane of the glomerulus is like a little filter, okay? And it has holes in it. The endothelium has little holes in it through which the proteins can go through. But the protein which is really, really big will not be able to go through. So that's one kind of selectivity. That's size selectivity. But what about charge selectivity? The basement membrane is negatively charged. And if you have a protein which is going to be also negatively charged, even though it's smaller, it will not go through because it's going to be repelled by the negatively charged basement membrane. So there is going to be size and charge selectivity, and we'll do a question on that soon after this particular question. So now that we understand some of the minimal change disease association, let's discuss some of the options. So there is 5 options. So option A says urinary sediment microscopy. Do we see any sedimentation in minimal change disease? No, the only thing we see is effacement of podocytes in electron microscopy, so that is not a viable choice. Option B, light microscopy or renal biopsy sample. Okay, by the way, what's the question? What is the most likely to be both abnormal and useful in the diagnosis of this condition? Sometimes I even forget to read the question, so it's very important that we read the question. So we have to find What is abnormal and useful? So we have to find abnormal plus useful. Useful. Okay, so we see that urinary sediment microscopy, there is no sedimentation. There is no abnormal sedimentation and it's not useful to me. So that option is out. Light microscopy of renal biopsy sample. Light microscopy does not show anything. There is no abnormality on light microscopy and it's not useful to me. Immunofluorescence microscopy of the renal biopsy sample. On immunofluorescence, there is no complement deposition, no albumin. Again, there is no abnormality and it's not useful to me. Electron microscopy of the renal biopsy sample, yes, because in electron microscopy we see effacement of podocytes. This is going to be abnormal and this is useful to me. That is my answer. Let's look at choice E just in case. Serum creatinine and bun levels. Do we really see an abnormality in serum and creatinine? Not that I know of. They could, but this is not a diagnostic thing. This is not really that much of an abnormality and it's not useful to me. It's irrelevant to the question. So in this case, clear out. The option is going to be D.